Planned Parenthood says more Ohioans are losing access to essential health care from their clinics. Basic services like cancer screenings and birth control. Dominique O'Neill joins us in studio. Dominique, what's this current situation?
Well, Michael, a few clinics in Ohio are facing potential closure, and others across the state say they're facing major funding pressure. The potential closures come as new rules around Medicaid reimbursements make it harder for some clinics to stay open. Planned Parenthood officials say thousands of low-income patients depend on these locations for reproductive and preventive care. With fewer clinics, patients in parts of Ohio may now have to turn to other options, such as telehealth calls, emergency room visits.
We will continue to provide as long as we can possibly provide. We may have to sort of regionalize and condense a little bit, but at the end of the day, our goal is to make sure that we continue to be here for patients as much as we possibly can, and that we continue to provide the great service that they expect of us.
Planned Parenthood operates 12 locations statewide. Funding cuts mean some locations can no longer accept Medicaid, which here in Toledo would affect roughly 40% of its patients.
Throughout our service area, we see about 50,000 patients a year through almost 75,000 visits. And of those patients, 22,000 can no longer access our services.
Staffing and appointment availability are also impacted, which make it harder for care.
So it definitely, that volume impacts our ability to staff. It impacts our, staffing availability. It impacts patient availability or openings. So all of those things are definitely impacted.
However, not everyone says the potential of these closures are negative. A local member of the faith community says it could reflect a cultural shift.
I think no one celebrates the closing of anything, the destruction of anything, but what it is signaling is a shift in the culture of America, that maybe a return to realizing that we don't want to head down this path anymore, that every child should have a right to life.
As for what's next for Planned Parenthood in Ohio,
we are just sort of evaluating what things look like across the state in each of our centers. And we hope to stay open in as many places as possible to serve the people who need us.
Planned Parenthood of Greater Ohio CEO says it's continuing to fight for funding and is urging lawmakers to protect access to reproductive health care. For a list of open clinics and where patients can go for care, you can visit our website, WTOL.com. Reporting in studio, Dominique O'Neill, WTOL 11.